My name is Beth Fries and I am a Family CNA for Solace Pediatric Healthcare. I have two daughters. They are 14 and 12 and they have a diagnosis called CLN3 Batten Disease. Their disease involves, it's neurodegenerative, so they have complete blindness, mobility loss, seizures, cognition around age 3 to 4 right now, behavior, incontinence, and the list goes on and on. Because it's a neurodegenerative, their needs will consistently increase until the end of their life, which is expected around late teens to early 20s. So we have been receiving therapy through Solace, speech, PT, OT for several years. And one of our therapists told me that they were starting the Family CNA program about a year ago, and I became interested in that and started the process at that point to see what it would take to become a Family CNA. So because we had already had an existing relationship with Solace, it was an easy choice. They have always been really good to our family. Their therapists have been top-notch. The responsiveness from the team has always been great, and so it was just a no-brainer to go with them and to continue that relationship. And they made the process very easy for onboarding. So a typical day as a Family CNA for my girls involves a lot of the typical things that you would do as a mom, but because my daughters are 14 and 12, it involves so much more. You wouldn't normally dress your 14-year-old or make sure they don't choke while having breakfast or dinner. You wouldn't bathe them. So those types of activities are crucial. Same with transferring them. Simply walking upstairs or getting in and out of a car involves a lot more hands-on activity that CNA has helped me achieve. So the experience of going through Family CNA through Solace was very easy. The onboarding process was good. They laid out everything that I would need to do. They were very receptive to feedback and questions. They were always available if I was stuck somewhere in the process. The schooling was easy because I could do it all at home, which was my choice. And then the skills lab was great, very hands-on training, very easy to do with with an experienced guide. So my mom also went through this Family CNA program, and we are able to trade shifts and always know that someone is here to work with the girls in the stickier situation that requires extra support that a CNA can give, and it's really comforting to know that.
I feel pretty privileged to be able to work with my family. We actually live here in the home. We have our own home in the basement, and Beth and I, my daughter, we work together to care for not just Cecilia and Lily, but with the 3 little ones also. And John's a part of that too. And to work together as a family, because the needs are so great, it's really important to pull together. And honestly, it's a bit of a balancing act because I'm a grandmother, I'm not the mother. So I have to be sure to be respectful of all members of this household and remember my role as a grandma to love and support, not to pass judgment or tell anybody how they should do their job. And I try to give them their space to do their loving and parenting up here. And I try to keep my distance at times so that they have their own family. But when I come in, it's really important that I'm quiet and supportive and loving to the whole family. Often, early in the morning, maybe between 5 and 6, Cecilia, she's an early riser, she will come knocking, and I've trained her somewhat to not, if I don't respond on the first knock, to go away, but I will hear her, and if she comes knocking, I'll get up, and it's my shift to be with her, and she has lots of ideas rolling through her head at all times, so she's busy talking and wanting to draw her ideas out, and I find that she'll need help with getting breakfast, so I get her some food, and we sit together. And after we visit for a while, I need to help her with her morning routines of getting her teeth brushed and making sure she's dressed and her face is washed. And I may help her and Lily out to the bus at the appropriate time. I may just come up and help them with straightening up their rooms, just being there for them because there's 3 other girls who still need to get out to the door and other people in the household who need to get ready for their day also. The training that Solace provided was great. It took me a little while to get through the book and the videos, but I got it done, and I was glad that it wasn't something that I had to do on a timeline. So I worked at my own speed and got that part done. The skills lab was fabulous. The nurse who taught that skills lab did a great job, and I was able to go back several times, and if I needed a refresher, I could go back and feel more confident in my skills.